This old guy is Bear. Bear's getting up there in years, and I want to talk to his owners today about diseases he will be at risk for because of his age and his breed. So as dogs get older, their cancer risk goes up. So cancer is a big concern for older dogs. The most common cause of death in dogs over age 12 is cancer, all different kinds. There's a couple main kinds that golden retrievers tend to get. Both of those we can see signs of on a complete blood count blood test. So we usually want to do that blood test at least once a year. Twice is even nicer. Lymphoma will sometimes show up as an elevated white cell count. The other kind of tumor that we're going to talk about is hemangiosarcoma, and we'll often see abnormal red blood cells under the microscope for that. Hemangiosarcoma is a tumor that arises out of blood vessels. So it usually shows up in organs with lots of blood supply. The spleen is the most common place for that tumor to grow. And it's going to get big. Those tumors start out kind of small and they just get bigger and bigger. And sooner or later they break open and start bleeding because they're like ginormous blood vessels full of blood. The dog can bleed to death within a few hours. So the key thing is you want to find it early and you want to get in there and do surgery right away. So the spleen is kind of tucked up under the ribs. On our little visible dog thing, it's the little purplish or maroon little thing here. On this view, we have it in red, and then this is a picture laying on the dog's back. It kind of lays across the left side of the abdomen. So when it gets a tumor, and again, you can see how big these things can get, it gets bigger and bigger, and they'll start to have this big looking abdomen, and we can often feel it when we palpate their abdomen. It's nice to remove those tumors when they're only 3 inches in diameter. This one here weighed about 5 pounds, and I've removed them as big as 8 pounds. So again, they're nasty things. It's a huge surgery to get them out of there. The earlier we catch it, the better off we're going to be. The symptoms that you're going to see if we don't happen to catch it on a blood test, or we don't happen to see him for his exam at the time when we can palpate it, we're going to see the dog get weak and pale because they're bleeding inside. So you don't see any blood on the outside, but the dog gets tired and pale. And the way we look for paleness in a dog, come here, Bear, is to look at the color of their gums. So Bear's got a lot of dark pigment, but we're going to look at the pink part. And it should be a nice healthy pink, just like your own gums or tongue would look. The first thing we're going to usually ask you, if you call us up and say, my dog can't get up the stairs this morning, or my dog seems really tired, the first thing we're going to say is, flip his lip up, what color are his gums? So this is something that you can help us out with at home, and if you're aware that this can happen, you can always be watching his gums, and if they start to look pale, that's a phone call and a visit that same day, hopefully. About a third of these tumors are benign, non-cancerous. So you remove them, you've saved the dog's life, everything's good. We have a little case study up here. This is Zeke. His owner noticed that his belly was looking big, but he wasn't due for his vaccines for another couple months, so she just waited. And so by the time we saw him, and I didn't vaccinate him that day anyway, because I took one look at him and went, oh my God, you should take an x-ray, you have a big tumor in there. Zeke went on to have surgery. So here we are opening Zeke's belly up, and here's this gigantic purple bleeding thing. So you see that the incision's about a foot long. This was about 5 years ago. He lived probably 3 years after that. We eventually put him to sleep for something entirely different. So here he is after surgery with his huge incision. It's almost a foot long. 2/3 of those tumors are cancerous, but we can still remove the spleen, save the dog for a time. If you do chemotherapy, we usually get 6 months to a year of increased life expectancy. The main problem with that is that we don't know whether it's cancerous or benign until we already have the tumor out and send it to the lab. You can't tell from an aspirate, so unfortunately this is a big decision that people have to make in a big hurry. The dog's bleeding, there's a big tumor, it could be cancer or it could be fine, what do you want to do? So sometimes it's kind of nice to think about those things ahead of time. It's great to have pet insurance if you have a young dog so that this kind of thing is covered as they get older. Once there's a pre-existing condition, you can't get insurance later, but this is one of the problems that people will run into. They love their dog has cancer, they want to treat it, but they can't afford the $2,000 or $4,000 or whatever it's going to be to treat them. We do have a blood test now that can tell us whether it's a cancerous or benign marker from the tumor that's in their bloodstream. but that test takes days to get back, and if they're bleeding, and you don't have that time. So again, learn how to look at their gums. Let us know if they ever start to have a big belly or any symptoms of weakness or lethargy, and be aware that sooner or later this may be the thing that happens.